Did you know that about 40% of people aged 65 or older have some sort of age-associated memory impairment? That's approximately 320 million people, or almost the entire population of the United States. Not only that, but according to the World Health Organization, nearly 10 million of that population will develop a variation of dementia, one of the most aggressive syndromes of cognitive deterioration. In this video, you will learn the main symptoms of memory loss, its different types, and most importantly, how to prevent and combat it. Let's start with the most common type, age-related forgetfulness, which is also the mildest. People who have this impairment tend to perform worse in standardized memory tests, compared to younger adults, and might go through day-to-day life experiences such as missing a monthly payment, sometimes forgetting which word to use, losing things from time to time, or forgetting which day it is. If you feel that these symptoms describe you, don't panic just yet. Remember that as we age, it's common to forget things from time to time. However, if you feel that there's a sudden change in your memory capacity and you are performing worse than usual in your daily activities, it is advised to seek medical attention just to be safe. In any case, here are some recommended activities for dealing with memory changes and forgetfulness, which may also help prevent them. Constantly learning new skills and concepts. Plan tasks, make to-do lists and use memory tools such as calendars or apps. Have a place for your personal things, like your wallet, purse, keys, and so on. Follow a daily routine. Watch your blood pressure. Exercise at least once a week. Get help if you feel depressed for weeks at a time. Let's continue with the next type of memory loss, mild cognitive impairment. There are approximately 160 million people worldwide who have this condition. This form of memory loss is a bit more severe than age-related forgetfulness, meaning that it carries important memory deficits but without functional impairments. In other words, people with this condition are able to continue to live independently but are bound to expect a much lower performance in memory-related activities. There are two types of mild cognitive impairment: amnestic MCI, which includes memory problems such as frequently misplacing everyday items like your wallet, quickly forgetting recently learned information, or forgetting to go to important events. And non-amnestic MCI, which is more associated with other areas of information processing, like problems in concentration and attention, planning, or navigation skills. If you are 65 or older or know someone that is and presents a lot of these symptoms, don't let them advance any further, because it could be an early sign of dementia. The activities previously mentioned for cognitive health still apply to this condition, but now it's especially recommended to visit a doctor at least every 6 months to track changes in your memory. It is also advised to quit smoking, limit the use of alcohol, get enough sleep, eat healthy foods, and be more active both physically and mentally. Finally, the most severe form of memory loss, dementia. It is the most frightening because it affects not only memory but also cognitive abilities such as language, problem-solving skills, and personality, and it is generally more difficult to deal with daily living activities such as dressing and feeding oneself. The quality of life deteriorates, and unfortunately, it gets worse over time. The main form of dementia is Alzheimer's disease, which accounts for almost 90% of all dementia cases. Some of the main symptoms or indicators that someone might have Alzheimer's are making poor judgments and decisions a lot of the time, losing track of the date or time of year, having trouble having conversations, misplacing things often and being unable to find them. We can't stress this enough, but if you know someone that matches these characteristics, then it is highly advised to seek medical attention immediately. Don't let the symptoms advance any further. And while it is true that currently there is no cure for Alzheimer's, it can be prevented by avoiding all the risks and behaviors that may lead to it, by taking part in the activities we mentioned before, which you can also add: get health screenings, manage chronic health problems like diabetes, and stay connected with social activities. Please see the description for a more complete guide to the treatments made by the National Library of Medicine. If you find the information useful, please consider liking and subscribing. And if you want to know how to improve your memory, watch this next video.